So Daniela, or Danny, this is Dr. Shannon and the operating room team at Gulf Coast Medical Center on April the 3rd, 2014. This is the initiation of your arthroscopic surgery. This is the tube that brings the fluid into the knee. As we back up and we'll take a look, we have a probe that we've inserted into the knee, and you can see the undersurface of your kneecap has a lot of wear and tear on the bottom side, some of this tissue which is kind of hanging down. Some people refer to this as crab meat. This is, it's also known, but medically, as chondromalacia. As we come along, and we'll look at, we'll go a little bit up into the superior patellar pouch and look for any loose bodies. I've already taken out one loose body, just so you know. We'll go down into what's called the medial gutter and take a look here. And we'll go across the top of the knee and look in what's known as the lateral gutter and see what we can see. See if we see there's some debris. No major, and there's a little bit of debris in the lateral side. So we'll now flex our knee down, and we're going to just follow the curve of your femur down. You can see where there's some wear and tear on the femur as we come down, and we'll come down into what's called the medial compartment of the knee, and I'll just adjust the knee. There's a loose body right there. You can see how that loose body has now floated down. There's two of them right there. So we'll get in a device to remove them if we can, maybe with suction attached to it. And sometimes if we do that, we can have an easier time of recovering those. Give me just a second to change my instrument around and get my bearings here. If I turn on the suction, there they go. There's one right there, and we'll have the suction. You can see how the cartilage is irregular on either side. Good. And how it's become thin. This is the medial side of your knee. This is not the side where the abnormality is, but you can see how the cartilage is very thin there and irregular and beginning to be worn out on both the femur and the tibia. As we come across the joint, you can see some scar tissue in here from the previous surgery. This is where your anterior cruciate ligament would be. And we'll then take a little different look at your knee by going into what's called a figure of 4 position on the outside. And this is where Dr. Wagner had done the repair of the osteochondral piece. You can see that there's a loose piece right here. So we're going to need to trim those pieces away. Let's see if I can move this so you can see better. I'll try to take a picture of it. Let me just adjust my camera just a little bit. But this right here is part of the reason why these pieces are loose. Although it looks like the main piece, which is in here, some of it's trying to heal. So we're going to trim some of this away. Here's the lateral meniscus. We'll look, and then we'll pass our scope into the back and look and see if we see any more loose bodies. Here's the edge of this piece right here. You can sort of see it. So the next step is to put this tool in that gives us an opportunity. I'll switch it to trim up the loose cartilage, and it has suction attached to it. We'll remove this part which is fraying down, and then once we get that out of our way, we'll be able to better outline the borders. So you can really see how that surface is irregular. And it's a pretty large piece, as you can see. It goes all the way around to the back. Can you flex your knee a little bit more, please, Mark? There you go. And we'll come around to the back a little bit more, and you can see where some of these pieces are loose. You can see as they oscillate back and forth with my tool that I'm using. So Danny, this is the undersurface of your kneecap. This tool we're using is called a radiofrequency ablation tool. It's designed to sculpt the cartilage and move away any tissue that may be impinging between the surfaces of the joint. You have quite a bit of abnormal tissue on the undersurface of your kneecap. You can see how I'm cleaning that up. We want to be careful here because this tool is I've had it on a very, very low setting. We don't want to injure any of the viable cartilage cells. We want to smooth this tissue out and make it so that as it articulates with your femur, there's less friction but we don't want to hurt anything either. So we'll sort of show you how that works. And then at the same time, this other tissue that may be in the way, we've taken out several loose bodies already, one of which was just about 11 millimeters long, so we've kind of done that already. That's good for your knee. We might find some more. We're going to come down a little bit into the medial compartment again and see. Hold that wand for me, please. Thank you. Take a look at the tissue. We'll flex down a little bit more. You can see where there's some irregularity here. Just off this looks like it's just off the weight-bearing surface, so it's not quite as much of a threat to you. And we can smooth that up a little bit. You can kind of get a feel for how that tool works. And we'll trim that a little bit and make that smoother. You've got, you can see the area here where the cartilage has been stripped away. We'll smooth up some of the cobblestone effect that you see here. This is on the tibia. This is on the medial side, not the side where your OCD lesion is. So I'm being very careful here to not overdo it. And then we're going to go across your anterior cruciate. And here we come to the lateral side. You can see where the tissue has quite a bit of irregularity. We'll begin to smooth this out more extensively than on the other side. We'll allow your knee to flex down just a bit. And then we'll come in here and begin to smooth these pieces. And again, this is on a low setting. And then the area where you've lost the complete cartilage, we'll have to take a look at. I'll sculpt this and see if I can smooth that a little bit. Let's see if we can, I'm going to adjust my focal point just a tiny bit. Then we'll be able to see, and again, any here of this tissue that's loose, it's not a good idea to leave any loose tissue, but to try to make sure that we don't get more loose bodies as you go. You want to try to not have this happen again. So you can see where we're working there. There's a loose body right there. You can see it as it adheres to the end of the probe. Sometimes we can take that, and if I turn this to a higher speed, I can disintegrate that loose body. So again, it shows you how powerful this tool is. And then we'll go back in with our probe in just a moment, and we'll see if we see any other areas of irregularity. So Danny, we found another loose body here in the back of your knee. You can see that. You get a good look at it. You can see it's a good size one. It shouldn't be in there. We'll take that out, and hopefully that'll solve some of the problems. I don't see any more back there. So Danielle, we're going to see if we can, let me just back this up just a little bit, get a better view. We're going to see if we think we've measured about an 8 millimeter plug of bone. We're going to try to take that from your knee. You'll hear us tapping. We go into the knee. We're going to go up to about 15 millimeters and then take a plug. And I wanted you to have a chance to see that. And then Danny, once we've done that, we kind of shimmy this out, or we toggle it out a little bit, and we're going to see if we can, now that will be your little new plug of bone. You want to take a picture of that, please, for me? So Danny, the next step, we've put the plug partway in, and now we're beginning to gently tap it in. We want to protect that cartilage that you see. You can see the bone, and we go just a little bit at a time because we want it to be, we don't want to have it to be too countersunk, but we don't want to lose where we are either with it. You can see how it's beginning to fill in the void. So then, Danny, the next thing is we're going to microfracture next to this. You can see we don't want to loosen it up, but we want to have it so that we penetrate the bone next to the cartilage. And the idea being that new cartilage will grow adjacent to it. And again, I don't want to loosen up our plug. and then we'll get new cartilage that'll come in time over this area right here. So you can see where our plug is, and hopefully that'll then stimulate new cartilage growth. So Danny, this is there's where your plug is, and we can see we're going to put your knee through a range of motion. It doesn't seem to have any intrusion onto the other surfaces. The other ones we think will smooth out. We've also you saw the picture before, but we took the plug we took from this bone, and we're putting that in as a little bone graft in there, so that'll fill in. So hopefully when these surfaces then smooth out, you'll be able to resume your athletic career. We anticipate about 6 to 12 weeks.